Greetings from the team Own Your Growth. And our team is here with another session with Dr. Deepa Shree. And a little bit introduction about Dr. Deepa Shree. She has completed her Bachelor's of Naturopathy and Yogic Sciences from the SDM. And she's also pursued her Master of Science in Counseling and Family Therapy from the She's strengths are yoga therapy, yogic counseling, yoga therapy for lifestyle disorders, stress management, acupuncture, teleconsultation for stress and lifestyle management. She's also good at yoga demonstration and yogic instructions, and she also gives wonderful diet counseling based on the principles of yoga and naturopathy. And today, ma'am will be talking to us on the effective yogic therapy in treating cancer. Over to you, ma'am.
It is first of all, a very nice initiative from you guys. I must congratulate you for it, and also thank you for the opportunity. And it's nice to be here and talk to all of you. So why I am chosen, or why I'm talking about the role of yoga as a therapy in management of cancer is because of my experience in working in HCG, which is Healthcare Global, which is a cancer-specific hospital in Bangalore and different part of the country. I was working in the main branch, Bangalore. And there, we were trying to integrate yoga therapy with a lot of other rehabilitative, practices. So there was a rehabilitation team which would get patients soon after the diagnosis or during the treatment process and post the treatment for, post-treatment rehabilitation. So you must all be aware of, I would not talk in specific about or in detail, in fact, about what mainstream or conventional cancer therapy will go through, but I'll just give you a very brief of what happens. So there, most of the times, cancer is either clinically diagnosed because of some symptoms. Say, for example, head and neck cancer. There's a ulcer that is not healing at all, or there's some sort of irritation in the buccal mucosa or in the throat, some hoarseness in the voice, so laryngeal cancers, or difficulty swallowing, or burning sensation during swallowing. So all of these symptoms, when it goes beyond the normal range, usually an ulcer will stay for hardly 4 days and then it'll go, right? So an ulcer that stays continuously, it is not healing at all with whatever you do. So with these clinical presentations, cancer is, after the biopsy and some investigations, it is diagnosed, or many a times it is also diagnosed accidentally. Okay, accidental diagnosis of cancer is also there. Most common cancer, that is the breast cancer in women, is diagnosed usually because she feels heavy, or there's some sort of hardness in the skin, some discharge, and also associated with pain and tenderness and things like that. And hormonal cancers are usually more so in the women, and uterine or ovarian cancers and breast cancers. So whatever cancer you take, it is either diagnosed with a clinical presentation. So they will have some difficulty when they come in, when they walk into your clinic, they will have some difficulty. Or otherwise, they, especially in breast cancer patients, usually functionally they are fine, but still there's growth or there's some hardness of the skin and discharge, which is not affecting their day-to-day function, but they're concerned. Okay. So how do you integrate yoga in all of these areas? So if the diagnosis is taking time, if they're going through investigations, what is the one thing that the patient will be going through is a lot of anxiousness. They don't know what is happening, but they are walking in and around a cancer hospital, meeting cancer specialists, going through all of these investigations, which are not very comfortable. So there's a lot of anxiety at that point of time. And starting yoga therapy right then, even before diagnosis, is very much like an ideal situation, because once the treatment starts, they're already overburdened or overwhelmed with the treatment process itself. And when you say yoga, because I've had this experience, especially post surgery or during chemotherapy, when I go and when I used to go there and introduce myself as a yoga consultant, they would look at me like, am I joking in front of them? Because for them, yoga is all about asanas. So if you go and tell them I'm a yoga consultant, they'll look at you perplexed, thinking that what yoga can I do at this point of time? I'm already very tired. I'm already very much, down because of the treatment and cancer. What yoga can I do? So, and they will not be in a state of mind many a times to listen to you when you say yoga is not only asanas, it's also breathing exercises, it's also pranayama, or it's also relaxation technique. So I'm telling you this point, if you are working in a cancer hospital, or if you are a person who would get to treat cancer patients, ideal is to start your therapy at the initial stages where they've not yet begun with their treatment process. Okay. So that's when they will be a little, at least in the state of mind, to listen to what you're trying to tell them. And anxiety. So you all know, I think, what you should do when a person is anxious. First thing that'll come to my mind or anybody's mind is relaxation technique. Relax them, right? But imagine you yourselves, if you're going through something that's very, making you very restless, or if you are anxious, say, for example, you have faced something that you're not ready for and you're anxious about it. If somebody says, sit and breathe, sit and relax, will you be able to do it? It's not very easy to relax especially when you're extremely restless and anxious, right? And that's the stage that they are in. So what should you do? Educate them, because most of the times, conventional medical faculty, the doctors, or even, people around, many a times they will not have the time to spend hours together with the patient to explain or clear the doubts. There'll be a lot of confusion. So talking to them, or more so listening to them, will help. That only will calm them down. So first talk to them, listen to what they've gotten to say, educate about what most of the times cancer is like a death sentence for a lot of people. So education is a big thing. When we say cancer is not really a death sentence, you can come out of it, provided you do step 1, step 2, step 3, and things like that, right? So that is an important education part that you have to do. Once you educate them and you talk to them, when they feel good and when they feel better, that's when you can start your relaxation techniques. That's when you can start your pranayama and breathing techniques that will help them. Okay, so that is one thing. Second, after diagnosis, what starts is the treatment process, right? So usually, say for example, let me take example of breast cancer for that, for us to easily, just a minute. So I'm sorry for the disturbance. Yeah. So say take breast cancer for example. So when somebody is diagnosed with breast cancer, based on the stage of the cancer, okay, stage depends on what is the size, how much it has internally spread, whether there is vascular or neural invasion that has happened, okay, based on that, and based on whether it has spread to other organs, multiple organs, it is staged to stage 1, 2, 3, 4 and all that, right? So if, say for example, if the tumor size is very big, they will not directly go to surgery, but before that they will do what is called as neoadjuvant chemotherapy. Okay, so what happens in neoadjuvant chemotherapy is this: they're trying to basically shrink the tumor so that it becomes resectable easily. Okay, so neoadjuvant chemotherapy is followed by surgery, and after surgery, when the tumor is removed, they don't want microcells of the cancer to go dislodge from the tumor site and go lodge elsewhere. So they want to prevent metastasis to various other reasons. So they will give chemotherapy after that and local radiation. Okay. So during the entire treatment process, patient will have a lot of fatigue, okay, tiredness, because cancer treatment is a strong treatment. It is not as strong as, or not as overwhelming as it is shown in the TV and in movies and things like that, but still otherwise it is a little tiring, okay, going to the hospital, taking chemotherapy, and followed by chemotherapy. Initially 2-3 days, certain patients will have a lot of nausea, will have fatigue, will just want to lie down and do nothing else. Okay, some part of it is definitely psychological, because I've seen a lot of clients who are like doing good throughout the treatment, throughout chemotherapy, without any fatigue or without any, I'm always lying on the bed. But there are a lot of patients who feel like, okay, I have cancer, I don't have energy. That'll come to their mind. So fatigue is one thing. It could be either psychologically driven or induced fatigue, or physical fatigue. Both are there. Okay. Second, there's a lot of anxiety, there's a lot of fear, and some people can also go through depression, low mood states. It will start with low mood states and then go to depression, mainly because of the diagnosis, and which is overwhelming. And second, financial burden of the treatment and investigations and things like that, because every cycle of chemotherapy, there are mandatory blood tests that need to be done. It's not like unnecessary, but it is mandatory. It needs to be done. So every time I invest, or I basically spend for all of these investigations and treatment, is financially tiring. So that itself can create a lot of anxiety, and for some people, depression. Fear of death is another thing that a lot of people go through. Fear of, or even the sorrow or sadness of missing out on things. For example, say if you are a avid traveler, you are a person who's very much interested in traveling. When you're diagnosed with cancer, it is like, okay, you cannot travel, you have to go through all of these treatment, you have to prevent yourselves from infections and things like that. So you are put under some restrictions, right? If you are somebody who enjoys eating and you cannot eat after that, all of these things that will reduce the quality of life is also affecting the mind, right? That is the second thing. And also chemotherapy induced nausea, vomiting, loss of appetite, ulcers, neuropathy in the hands and lower limbs. Neuropathy is one of the very common thing. And also many a times acidity, bloating, constipation. And for a lot of people, chemotherapy also induces hearing loss. Okay, so all of these combination of complications and side effects, along with that superimposed emotions, everything will basically reduce the quality of life of the patient. So when you're doing yoga with them, at every step, be it pre-treatment, during treatment, post-surgery, first thing is to basically make them comfortable. Okay, so it is not always necessary that you make them do an asana or some pranayama, but talk to them, listen to them, educate them. These are like the mandatory things, or the first things that you will have to do. And then start, see, 2-3 days after chemotherapy, they're tired. After that, they are in good energy. So that is when you have to start making them do asanas that will improve, good breathing. So chest expansion practices that will improve their breathing process, and also when you make them do slowly, it will relax them, so that will help them. So practices for neuropathy, what can you do for especially the lower limb neuropathy? Leg stretching, toe walking, heel walking, calf muscle stretching, lumbar exercises for the lower back. All of this will help, right? But you should always make sure whether if there is any bone metastasis, if your patient is already in stage 4 and if there is bone metastasis, then you should be very careful in what asanas you choose or what practices you choose. Okay, most of the times it is vertebral mets. Okay, vertebral mets at any level, usually lumbar L4, L1, L2, or sometimes even in the, cervical I've hardly seen, but lumbar and thoracic vertebra is what are usually involved in metastasis. So when they have mets, what is the one complication that you should always have at the back of your mind is pathological bone fractures. Okay, so when you're making them do asanas and things like that, if you give them asanas that will put extra load on the spine or on the vertebral column, that can lead to a pathological fracture itself. Okay, so that is one thing that you should always remember. So clinically, what we see, I will go to the next step of what we study and what is practically different. Okay, we study, for example, Kapalabhati and Bhastrika improves lung capacity, right? That is one thing that we study. But if I apply the same thing and say, okay, Kapalbhati and Bhastrika improves lung capacity, we have to improve the lung capacity of a person going through cancer. And if I make them do all of this, it will lead to a lot of complications. Okay. So Kapalabhati, Bhastrika, or any hyperventilatory yoga practices or breathing practices have to be avoided throughout the treatment. Okay, because there have been cases where a patient with lung cancer has collapsed on spot doing Bhastrika Pranayama. Okay, so Bhastrika Pranayama is something that, requires a lot of energy and strength, right? So if somebody has a lung cancer and pulmonary edema and things like that are the complications that can occur with Bhastrika or Kapalabhati Pranayama. Okay, or somebody who has lung mets, or somebody who has compromised pulmonary functions, somebody who is already very fatigued because of the treatment. You should never make them do hyperventilation. In general, it is wise to avoid hyperventilatory practices during the treatment. Post-treatment, when they're 3 to 5 months after the treatment, they can start Kapalbhati Bhastrika, but not before that. Okay. Another difference that I have experienced myself is Brahmari Pranayama. Brahmari Pranayama, they say it improves your laryngeal function. That's what we study, right? It improves your voice, it improves your voice box function and all that. So for somebody who has a laryngeal cancer and it is treated, and especially stage 1 laryngeal cancers, post-treatment, they have a lot of hoarseness in the voice. Later stages of laryngeal cancer, they remove the voice box. So literally there is no voice box for them to speak. But for some people who have early stages, they do larynx conservatory surgery. Okay? But post-surgery, until the healing happens, the voice is very hoarse or it is very feeble, and the strength is not there. So if I speak 2 sentences, I'm tired and I want to rest and things like that. So when larynx is already compromised, and if you make them do Brahmari Pranayama in an already compromised larynx, then it will aggravate the condition. Okay, so Brahmari Pranayama is something that should not be practiced in a compromised larynx. That we will not study in our college. In our college, it is told that Brahmari Pranayama improves laryngeal function, so you can make them do. Makara chanting will help. It will definitely help, but not in a compromised larynx. So you should give laryngeal function to time for the laryngeal function to improve. So mostly breathing technique will help. Warm water gargling will help. Warm water sipping will help initially. Okay. Most of the times we also feel that cold water improves healing, right? But cold water at that point of time might not improve the healing process. So warm water gargling, warm water sipping will improve. And once the voice is better, once the strength of the voice is better, then you can start with chantings or Brahmari Pranayama. Okay. What else is the difference between what we study and what we have to do, especially when it comes to cancer, is back strengthening exercises. Back strengthening, these lumbar exercises that we do are very, very effective. for all the cancer patients. But like I told you, if there is a vertebral mets, then you will have to take care of it and do. Okay. And you should also know what surgery they've gone through. Say, for example, abdominal surgery or a colostomy bag, if they're moving around with colostomy bag and things like that. If you make them do Pavana Muktasana or lumbar stretches at that point of time, it will not be comfortable and it's also not advised. Okay. And breast cancer, again, breast cancer, there's a lot of, say, for example, right breast cancer was there and the tumor was removed. Along with the tumor, they also remove the lymph nodes, right? So when the lymph nodes are removed, what happens? There's a lack of lymph drainage and swelling. So all practices that will concentrate on draining the lymph is what you should concentrate on more. Okay. So most of the times what happens post surgery, if you make them do all of this, they will not be in the state. That is why ideal is to start before surgery. Before surgery, teach them these are the practices that you will have to do after surgery. So they will have in their mind that, okay, post surgery, these are my exercises. After surgery, go meet them, remind them of their exercises, and they'll be fine. So with that, I think if you have any questions, specific questions that you want me to answer, I will do them for you. Otherwise, in general, or to sum up, I have to say, yoga therapy is very, very effective during the treatment process, but you'll have to just practice it or administer it very scientifically. Okay, that's point number one. Point number two, what is so good about yoga during cancer is in all the yoga practices, be it asana, be it pranayama, be it relaxation, be it meditation, you mainly tell them to concentrate on their breathing, right? So there is this, you can read papers on it. When there is hypoxia in the tissue, you know what hypoxia is, right? So when there is hypoxia in the tissue, it is like a trigger for cancers to metastasize, cancer cells to spread. Okay. So hypoxia can be very beautifully taken care with our practices, right? Just make them breathe, lie down, breathe, sit, breathe well, improve your inhalation, improve your exhalation, improve your lung capacity. That itself will take care of the tissue hypoxia. When the tissue hypoxia is not there, then the cancer cells will not tend to spread. Okay, so one of the basic enemy for cancer cells or one of the basic thing that will promote cancer spread is tissue hypoxia. So if you can take care of tissue hypoxia, that itself is a good thing. You're not just doing something about quality of life here, but you're directly targeting cancer cells, right? Second important thing, see, I'll not tell you quality of life and all that. That's something that you already know. Second thing, practicing all of this practices, yoga techniques, is proven to bring down the inflammatory markers. That's something that we already know, right? There's so many papers from SVASA itself that says yoga practices brings down the inflammatory markers, right? So during cancer treatment or when somebody is diagnosed with cancer, inflammation, low-grade inflammation and the local cancer site inflammation is extremely high. Okay, so what do you do with yoga is you're bringing down that systemic inflammation. Again, you're directly targeting the cancer growth, right? So you are bringing down cancer growth then and there. Third thing is insulin or say diabetes. If somebody is diabetic, they are at risk of developing cancer. Okay, so if I am a diabetic patient, I am at risk of developing cancer because my sugar level is high and therefore at times my insulin can go high, and insulin is a growth hormone, so it can induce tissue growth which can become uncontrollable and turn into a cancer. Okay, so you can directly prevent cancers working on diabetic patients, right? So at the preventive stage only you are working on prevention of cancer by reducing their blood sugar levels, by reducing their HbA1c, right? So yoga is not just effective during cancer or post cancer. Most of us think that when somebody comes with cancer, okay, first let them go through the treatment, I'll take care of them later. No. Cancer, when you say cancer, pre-cancer is prevention, during cancer, post-cancer. All three stages, yoga can be very beautifully integrated. Okay, and that's what we should aim at doing. That's what we should confidently start saying. Yoga can definitely improve the outcome of cancer treatment. It can prevent cancer. Stress is something that is proven to promote cancer metastasis. There's a lot of papers, there's a lot of studies that say stress promotes cancer metastasis. So if I'm diagnosed with cancer, secondary mets or tertiary mets can happen if I'm stressed. So we are very well equipped with stress management, right? So at whatever level you take, whatever level you want to handle, yoga is something that you can integrate. So now take end of life care. Somebody who's in stage 4 and who really do not have a lot of days to live or a lot of months to live. So what can you do for them? Spiritual distress is something that most of the cancer patients go through. Okay, we had studied in HCG with head and neck cancer surgeon. We had studied on oncotheology, how oncology or cancer is basically changing your perspectives or belief systems in God and in spirituality, in some universal power and things like that. And there were, some people who said that they lost all belief in God and existence of God after they've diagnosed with cancer. There were some people who said their belief improved. They became much more strong after they've been diagnosed with cancer. Okay, but at the end of the day, especially in end of life care, most of the patients go through spiritual distress. What is it after death? What have I done in my life? Is it because of some mistakes that I've gone through cancer, I've diagnosed and I'm dying? How do I take care of the things that I'm not? So a lot of spiritual distress is there. So yoga is definitely very effective tool in managing spiritual distress. Okay, so like I told you, every stage of cancer, every step of cancer treatment or the entire process, yoga is very effective, integrated system that you can work with. Only if you know how scientifically and practically you can implement it. Okay, we cannot promise that I will be able to cure you of cancer without any other treatment. Just come and do yoga. There can be cases that have happened like that, but you just don't have enough time. Okay, and you do not have control as a physician on the willpower of the client. If I am diagnosed with cancer, if I am strong-willed, I can say, okay, I will do yoga, I will take necessary treatments and I'll get out of it. But if I am not a strong person, how much ever yoga you teach me, I might not get the benefit out of it. So it is very much custom made to each individual. If you feel that the patient first requires boosting, don't start with yoga, start with boosting, then go to yoga. Okay, so you should be very scientific and practical to see which tool to use, when to use it, and how do I custom make it to each client. Because like I told you, every practice is not suitable for every patient. Every breast cancer patient presents differently and goes through the treatment process differently. The cancer might be same. It is breast cancer going through so many hormonal changes and things like that. But presentation to each individual is different. So that is the basic thing that I would want to say. If you have questions, please feel free to ask them.
Okay, ma'am. Thank you for summing up all the experiences that you have gained in all of these years.
Yes, thank you.
So my first question is, so you were talking about what we shouldn't be doing in cases of lung cancer and laryngeal cancer and things like that. What about the cancers of reproductive system, especially in females?
Okay.
What are the do's and don'ts?
See, when somebody is going through hormonal cancers, most of the time reproductive cancers are also hormonal cancers. Hormonal cancers are kind of tricky. They tend to, they're a little aggressive also in nature. So their treatment process should parallelly be happening. That is the first do's. So what is the first don't is that you should never stop any treatment process. Okay. When it comes to yoga specific, say for example, somebody is diagnosed with uterine and ovarian cancer or uterine cancer, and most of the times during surgery, they'll also remove the ovaries if they are done with their family, and if the doctor feels that the ovary is no more really necessary, then they will remove it. Okay, so when ovary and the uterus is both removed, a lot of patients have difficulty first sitting down itself. The doctors would have told them don't sit down for some days, but they would have made it a habit not to sit down at all. So if you meet them after, like, say 6-7 months after surgery, they'll have difficulty sitting down. They'll only sit on the chair. So in a physical term, you will have to first improve or increase their pelvic strength, their abdominal strength, lower back strength. So that is a very important thing that you have to do. They might not come and tell you that I have back pain. They will just come and tell you I have uterine cancer and my uterus is removed. I'm going through so and so. But it is mandatory for you to work on their pelvic, lumbar, abdominal region. Okay. When it comes to hyperventilatory practices or practices that put pressure on the abdomen and lower abdomen, so Dhanurasana, Bhujangasana, Kapalabhati, Bastrika, or even, for example, a lot of front bending postures, something that needs to be avoided initially, especially post surgery. 3 months, no practice that will directly affect the suture site. Okay, that's mandatory for any surgery, not just cancer surgery, any surgery you take, for example. Okay, so anything that will increase the pressure on that region, on the lower abdomen, on the pelvic region, is something that needs to be avoided. You should not, just because it improves circulation to the pelvic region, I'll make them do all pelvic exercises, something that you should not be doing initially after surgery. After their treatment process is done, you can start increasing, strengthening the pelvic muscles and increasing the blood circulation. All that can happen. So that is one thing. Otherwise, mandatory all upper limb exercises, upper body stretchings, breathing exercises, pranayama, slow pranayamas. Nadi Shodhana pranayama is like the best thing. I've seen that not just in adult cancers, but even in pediatric cases. Okay, say for example, a child is going through some hematological cancer and they're going through chemotherapy, they will have a lot of nausea. Okay, and they have a lot of restriction, especially pediatric cancer patients. They have a lot of restriction. Don't eat that, don't eat this, don't eat anything from outside, don't eat ice cream. Things that they like the most, they're not allowed to eat any of it. So they will have a lot of restlessness and also chemotherapy induced nausea. Make them do Nadi Shodhana pranayama, and immediately after that, they're in full energy to jump around and play with you and do everything that you ask them to. Okay, because it works much better, or it works better in pediatric cases than in adult cases, I must say, because they are not prejudiced with anything. Adult patients, if you tell them do Nadi Shodhana, they're bored. Oh, I have to sit and breathe 10 rounds, 20 rounds. Oh my God, sitting, my hand will start paining, my back will start paining. All that is not there when it comes to pediatric population. They're very happy because you've given them some activity. They'll do, it'll also give them effect. Okay, same when you come to adult cancers. Now you asked me for reproductive cancers, ovarian, uterine cancers. you should avoid something that puts pressure, and work on after surgery, after 6 months after surgery, you can work on pelvic strengthening, back strengthening, abdominal muscle strengthening exercises. And they one other point with reproductive cancers, I must say, see, if a woman is uh, devoid of her uterus or womb, it not only affects her body, but a lot to her mind also. There's a lot of effect on the mind, not just in cancer patients, but if you see a woman after hysterectomy becomes very vulnerable. She has a lot of problems after hysterectomy. She becomes mentally weak. Her willpower comes down. Her fear increases. Okay. I don't know if you guys are aware of TCM, traditional Chinese medicine. If you know the principles of traditional Chinese medicine, you can very beautifully correlate why it happens. I will not get into that now because it will unnecessarily take time. But so for reproductive cancer patients, especially after surgery or after treatment, if their organ is removed completely, you should work more on the mind than on the body to boost them up, to boost the women up, because they're low. They don't have one important organ. Most of us feel that uterus is only for reproduction. No, not necessarily. Uterine functions are very deep and very vast. Okay, it is something that gives her a lot of willpower and strength. It is removed, it will directly hit her there at the mind. So you should work on improving the mental functions, especially emotional stability is what you have to work on in reproductive cancers.
Okay, ma'am. So you were talking about the pediatric cancer patients. So
Yes.
would you like to share what are the struggles that we will face and what ways in which we can, make it work?
Better. Pediatric cases are one of the easiest, I must say, to handle. And some kids are definitely not very friendly. They don't listen to you. They are very cranky. They're always crying. They're always low on energy. That is there. I will come to them a little later. But there are other pediatric population who are very, positive. They will give you strength. In fact, I must say, you will have a lot of learning process treating these kids. Okay, they will have very intriguing questions. They will ask you, why did I get cancer? They will ask you, okay, I know I'm going to die after a few years. How should I prepare my parents for it? They will come and ask you, what happens after death? I'm diagnosed with cancer, so I'm going to die. So what happens after death? So when I was talking about spiritual distress in adults, these kids come to you with those questions that are very intellectual and are very spiritually oriented. Okay, so you will have to prepare yourselves, buck yourselves up to and face those questions and answer them for kids in the way that they will understand. Okay, and also when it comes to pediatric population, if you tell them once, it'll be in their mind. If you just tell them don't eat ice cream, they will kind of rebel. Why should I not eat ice cream? But if you explain what are the pros and cons of doing something, then they will very, promptly follow it. So again, in pediatric population, talking to them in a way that they will understand will make your job 80% easy. If you teach them Nadi Shodhana Pranayama once, they will remember it. If you tell them you should practice it every day twice, these are the benefits. You will not go through nausea. You will not go through fatigue. They're very happy to do it. Okay. So the group, that pediatric group, which is not very cranky, are very easy to handle and at the same time very tricky to handle because they have very nice questions that they will come to you with. Okay, so you will have to handle them. Most of the times we tend to look at them with a lot of sympathy. They will not want that sympathy at all. Keep that in mind. They would not want you to go and tell them or show them that you're sorry for what they're going. No, they want somebody who will make them feel energetic because they are put under a lot of restrictions. You should make them feel energetic. So all kids yoga that we do, all practices, yogic games, breathing exercises are they're something that they're very happily they will do. Okay, but what you as a doctor should take or be precautioned about is the area where you are making them do it. It should not, cause any infection and things like that. Well ventilated area, then that should be okay, spacious and well ventilated. For children who are cranky, you can't make them do a lot of yoga. So yogic games will help. Okay. And for that population, you should have a lot of patience. First thing, because first day you go and you say yogic games, they'll not be really interested. Be like, what yogic games? I'm not going to come and play with you. Who are you? They will not even first recognize you. So 2-3 days when you go meet them, talk to their parents, they're like, okay, this person is always coming. They gain some trust. There is some relationship. There's some rapport that is built, and then you start with them. Start yogic games with them, not directly any pranayama. Especially pranayama will not work. From yogic games, you can shift to asanas. From asanas is from where you shift to pranayamas. Okay, that's the way to deal with pediatric cases. In my experience, I've had real good experience with pediatric cases. I've really not had a lot of cranky patients, but definitely patients who ask you real good questions, not just very small kids, but also adolescent children. When they come, they know certain stuff, right? So I had one boy who came and who came and asked me. I am now, he was, I think, a 16-year-old boy. I'm now 16-year-old and I have this cancer. I know my time is limited. My parents are really worried about it. So how do I prepare them for my death? Is what he had asked me, okay, in one of the yoga sessions. So they will ask you such questions, okay? And when they are asking you such questions, you should not feel or you should not be taken aback. You should be able to confidently talk to them. So you should prepare yourselves for things like that.
Okay, ma'am. So cancers are again some of it are due to bad habits such as smoking, alcohol, tobacco use, and things like that. So even if there is a first round of cancer and we do all the treatments and we bring them up, how can we integrate yogic concepts to make them come out of the addiction, or is it possible in that way?
It is possible. In HCG, actually, we had a team that was working on smoking cessation for cancer patients as well as people who were smoking and who had come with some problem, but it was not cancer, but it was like a pre-cancerous condition, things like that. So smoking cessation will help, but not very easy only with yoga. Okay, certain amount of counseling is necessary, and if their history of smoking or alcohol addiction is very strong, then medications are also necessary. Only when you put them on medications and when they don't have see, when you start de-addicting them, they'll go through a lot of that fight from the body is there. I want nicotine, I want alcohol, you're not giving me. So that withdrawal symptoms, if you're able to manage withdrawal symptoms with mild medications, if it's very strong, then with medication support, doing yoga will help. Okay, many a times if the withdrawal symptoms are very high, it's not possible for them to sit and do yoga with you. Yoga is helpful, but if somebody is inclined towards it, yes, it is easy. But most of them are not inclined. Okay, I met one person who was diagnosed with, if I'm not wrong, cancer of the buccal mucosa. He got it because he was an avid drinker, like, day in, day out, he would only drink. So, and after surgery, he was in very bad state. He was not able to swallow, so many complications, but still, he was so much inclined towards drinking. He said, discharge me today, I will go home. And from tomorrow, he would stay in his son's house. There is a bar right next to my son's house. I'm going to go there and drink. You don't make me do yoga. You don't give me all of these counseling. Just discharge me and I will be fine. So it is not very easy to de-addict them from alcohol consumption if they're so much inclined towards it, and they also fear facing the withdrawal symptoms. So you should be able to take care of the withdrawal symptoms and then integrate yoga. And there was one case who was a smoker, very chronic smoker, and he was also diagnosed with I think laryngeal cancer. His larynx was removed, and there was a he would speak through there's an external device that they insert here, and he would speak through that. He couldn't speak through his mouth. So after he was diagnosed with cancer, his family left him. Okay, so he was all alone, and he had made 70 other youth to stop smoking, giving out his own experience of what happens with smoking and things like that. So you get two different categories of people. With people like him who are inclined towards quitting, you can make them, your job becomes easier. When they're not inclined, medication counseling is something that becomes very handy, and with that support you can do this. And also there are a lot of dietary advices that are beneficial for these patients, that will help them come out of this withdrawal symptoms faster. Okay, it is like you asked me, it is helpful. You can plan on de-addiction, but it's not a very easy job. Okay.
Yes, ma'am. And so we had spoken about asanas, pranayamas, and all of that for cancer patients. How about kriyas, shat kriyas? You did cover about Kapalbhati, and what about Neti and practices like that?
Head and neck cancers, during the treatment process, is definitely not possible for them to make them do any of these techniques. Okay. A post-treatment, it'll help them with cleaning, but it depends on what is their functionality and what is the morbidity that is caused. Okay, so if the person is not able to breathe through the nose at all, you definitely can't make them do Zalaneti or Sutraneti, for example. Okay, so head and neck cancer patients, it is effective if their morbidity is minimal, and post treatment during the rehabilitation phase is when you can introduce all of this. For other cancers, say GI cancers and things like that, Vamana Dhauti or Vastra Dhauti is definitely not a very good option, because Vastra Dhauti, normal people itself, they are not very comfortable doing it. And it is initially in the learning process, it is a little tiring, right? Removing the vastra, and also there's some people vomit after that, and for a lot of people there is some sort of an irritation or burning throughout the day, right? So if you have to teach somebody during cancer these shat kriyas, it is not really that easy. And I personally have not administered or advised any shat kriyas during the treatment process at all. I've not done. Post, or even say breast cancer patients and uterine cancer patients or some other bone cancers and all that, if they have like sinusitis, which is not a related thing, but otherwise by their body constitution they have it, you can make them do shat kriyas. That shouldn't be a problem. But you have to be like I told you, head and neck cancers, GI cancers, lung cancers, you'll have to be really very careful. Definitely not advised during the treatment process. Post that, during rehabilitation, you can slowly introduce based on what is the functionality of them, what is how much of morbidity it has caused, and after that you can.
Okay, ma'am. So how should a naturopathy doctor prepare themselves to counsel cancer patients? Because you told they come with intriguing questions and existential crisis and things like that, and facing them on a day-to-day basis again will have a toll on ourselves. So how do you think we should equip ourselves for the same?
See, this, I think in general, I would say, if you are a strong-willed person, or if you are a person who can come out of crisis a little easier than the other people, then it is wise to choose working with cancer patients. If you are a person who is not very strong, if you know that you're not a very strong person emotionally, then working with cancer patients can lead to two things. One, you coming out of it as a strong person, because you were a weak person and seeing through all of that, you realize that your weakness is nothing compared to what they're going through, and you can come out as a strong person. Otherwise, it can further put you down. Okay, so one thing is that. Second thing, you should be really okay to see them in very bad states. Okay, uh, for example, when I was trying to make one of head and neck cancer patient breathe, he had a lot of mucus. Post surgery, there's a lot of mucus. Post anesthesia, especially, the lungs produce a lot of mucus. So whenever he would cough, the sputum would just, come out, and come out. And at times it would be so strong that it would fly far off distance and, lodge there. So you should really be prepared for such situations mentally. For a lot of people, seeing that itself, kind of irritates them. There's nausea, there's vomiting. I cannot go through that. It's very disgusting. If you're a person who feels that all of this is disgusting, it might become a little challenging for you. Okay, that is one thing. I'm telling you all of this because a lot of times you do not know. You only think that, okay, working with cancer, teach them yoga and come. No. Seeing them in worst cases is also something that you should be ready for. For example, a head and neck cancer patient, if you see them before surgery and after surgery, many times you cannot even recognize them, because surgery would have made a lot of change in their face, in their neck. So you cannot even recognize them. So if you go and stand in front of them and you don't know whom you are speaking to, or you give out an expression that, oh shit, this person has become like this, then that's not a good gesture. Okay, so all of these things is something that you should be mentally prepared for. Okay, that's one thing. Second thing, whatever counseling you do for a cancer patient, you should do, say, for example, there's a cancer patient in front of me, I'm counseling them. After they move out, you should not continue with, oh, what did they say, what problems they were going through. You should be able to close yourselves. Okay, that in yoga we say, detached attachment is something that needs to be very, very practically practiced here. You will get used to it. It's not very easy in the beginning, but you will get used to it. You cannot emotionally attach yourselves to a lot of patients, because especially in cancer, some people are in their end stages and you lose them. You were seeing them yesterday and today they're not there. All of those things are there. That should not leave you disturbed. Okay, detached attachment is something that you will have to practically practice when you're working with cancer patients. You cannot get attached to them. At the same time, you cannot be careless about them as well. So that balance is what something you have to bring. Scientifically, you will have to read, prepare work yourselves with a lot of scientific knowledge, a lot of practical knowledge. What I basically did is, even though I was working as a consultant in HCG, I did not take step back in going and sitting with doctors like how interns do or how students do. As intern, as a student, I will have freedom to go sit with the doctor, ask questions and learn. But once I become a colleague, I should not put restrictions to myself. Oh, I'm a colleague now, I'm a consultant. Can I really go sit with the doctor and ask questions? Can I really go sit with the doctor and see how a cancer patient presents? No, I myself feel that it is not the right approach. So I was going and sitting with head and neck surgeon. I was seeing how the patient would present, how they would come, what is the presentation. So that way I prepared myself to see what are the practical difficulties, because first of all, in our hospital setups, we do not see a lot of cancer patients day in and day out. We do have some who usually come after treatment for rehabilitation and things like that. During the treatment or during this one, active cancer phase is when we usually don't see them. So you will have a lot of practical deficiencies in you because you do not know how they present. So that way, I would suggest if somebody is going and working in a cancer hospital to take 3-4 months, 5-6 months to go visit different doctors, talk to them, and understand how is the presentation. A lot of in HCG, especially, there was a lot of multidisciplinary meetings that would happen where each department would discuss cases. So it might really not help me in any way, but I would go sit there and understand what is the pathology, what is the physiology, what investigations are important. Because many a times patients will come and ask you, I have asked to get a PET scan done. What is PET scan? You should first know what is PET scan. You should know what is an USG. You should know how it is done. What are the preparations you have to make for yourselves during cancer and breast cancer? If the breast is removed, what options do I have? What are the sexual changes that I can go through if I'm going through cancer, especially reproductive cancers? How do I manage all this? So certain general knowledge about what a cancer patient goes through is something that you should be prepared. You cannot only read about yoga and go. You should know in practical aspects what happens with a cancer patient. And then because yoga is something that you know, what you don't know is practical aspects in a cancer phase. So that's what you should prepare yourselves with.
Thank you so much, ma'am, for answering all of my queries. Thank you so much. I think we have come to the end of today's session. So any parting thoughts from your side before you end?
See, I was working in HCG like 2 years ago. Now I'm working comfortably in a clinic, seeing a lot more other cases than just cancer. So talking to you about cancer care was something that took me back a few years and kind of stimulated all of those experiences and memories that I had. It was a nice thing to talk to you about it and help you in any way that was possible. I don't know whether the session was helpful. For people who watch it and give you a feedback, then I think you will know whether it was helpful for them or not. But for me, it was definitely a nice thing. What I would suggest or give points from my end is cancer care is a very important area that is basically requiring our support, our involvement. Okay. And we hardly have people who go there. Okay. We really do not have BNYS doctors who work in cancer care setups. There are a lot of MSc yoga therapy people or YIC people or somebody who has done, who've really not done even these certifications, who work with different NGOs, who work with different organizations and teach yoga. I have seen myself, there was a team who would come to HCG with this rehabilitation things like, and these people who teach yoga really do not have any scientific knowledge of yoga, and they do not know how one should modify the yogic techniques for therapy. Practicing yoga in general is very much different than practicing yoga as a therapy. So we as doctors in yoga and naturopathy, we as clinicians in yoga and naturopathy who have scientific knowledge, who have philosophical knowledge, who have experience in practice, I think we should enter these areas and integrate ourselves with cancer care and give the best that we can, because they require us. When we go and talk to them, doctors are very happy that we're able to do these things for patients, but they do not have anybody to do it. Okay. So I would request anybody who are interested in cancer care, please go explore and start working, start involving yourselves in that area. And I think it is the need of the hour as well. And not just yoga, you are a yoga and a naturopathy doctor. So there's so many things acupuncture can do in cancer care. Many times we say don't needle a cancer patient, especially cancer site and all that. you have restrictions, but there's a lot of things that you can do as an acupuncturist who is trained, who has medical knowledge, who knows the anatomy, and can do wonderful things in pain management. And TCM based acupuncture is even otherwise helpful in a lot of side effects that cancer therapy goes through. Okay. So I think you are, as a yoga and osteopathy doctor, very well equipped with nature cure, with acupuncture, with yoga, with a little bit of knowledge on counseling. So you are like in yourselves a very good holistic person who can go and help cancer patients and also improve the treatment outcome. So that's one thing that I'll definitely tell you. All of you who are listening to it, or who is going to listen to it, please, get yourselves into that field and start working.
Thank you so much, ma'am. I certainly did have a lot of things to take back from this session today. And I'm sure you've stressed upon the importance of getting into this field and playing our part in helping people out of this. So I'm sure when people watch this, they will realize the need and will work for it. So thank you.
Because there is support. We need not have to really be scared of what can I do in cancer. That I understand there are a lot of interns or students or even doctors who are not very confident in dealing with cancer patients. But it's not that difficult also. You should just be mindful and you can do it. The people who can support you, who can guide you, there's Dr. Raghavendra Rao, who has worked in HCG for so many years. He is full of experiences. So we need to, kind of drag him out of his busy schedule and sit and talk to him. You'll get to learn a lot from him. There's so many other people who are working. So there is support and guidance. If we can just take care of the fear part or the confidence part in us, I think we can do a great job in cancer.
Thank you so much, ma'am. Thank you so much. I think we all should put this in our minds and work for it.
Definitely.
Make this our collective goal. Thank you so much. Thank you so much, ma'am, for accepting our platform's offer and giving out this wonderful resource out there. It's going to help people coming up. Thank you so much.
It was a great opportunity and I enjoyed discussing things with you. Thank you so much.
Thank you so much.